So here's who will be talking today. You got Dr. Aaron Weinberg. Aaron, if you want to maybe introduce yourself.
Sure. Well, thank you, Cesar, for inviting me to join this discussion. It's nice to see everybody here on this call. I'm Aaron Weinberg. I'm a pulmonary critical care and internal medicine doctor. I spent almost the last 10 years at Cedars-Sinai in Los Angeles. I was on the academic faculty there, doing both clinical research as well as patient care, and joined Carbon in July to help head up program development, as well as, in addition to that, we're also launching a clinical research division. So it's been really exciting to be here at Carbon during this hyper growth sort of phase, and I think the potential is just incredible. So just the stuff that we've already accomplished as a collective group in COVID, from the testing to the COVID positive care program. We've had almost 700 patients go through that program. Those that have been positive with COVID, we've helped manage their condition virtually with that. Obviously, the vaccination program has been a great success, getting vaccines in people's arms, partnering with the city of LA. So really exciting things on the COVID front. We've also done a couple research studies, two national diagnostic studies. So there's been a lot of exciting movement, and we hope to grow these programs and do more beyond COVID as well. So it's a pleasure to be here and happy to answer any questions during this session.
Thanks, Aaron. And I'm Cesar Chaveharian. I'm Chief Clinical Innovation Officer, one of the co-founders of Carbon Health. I trained as an emergency medicine doctor. I still practice in the ER. So I'm seeing on the front lines what's going on with the pandemic. I started my career in actually virus research at Stanford. So I did a cytomegalovirus research there, creating a cosmid library at the time. And then in med school, really focused on informatics, so medical informatics, or the use of technology in healthcare. And then in residency, focused a lot on evidence-based medicine. So part of that is to really read the clinical research and gather really what the data show, rather than maybe what the conclusions of the authors are. And so you're getting a bit of a mix of, clinical experience with research analysis and again, real world experience from the front lines from us. So Carbon Health, a little bit of background, it's a technology-enabled healthcare provider. So first and foremost, we're your providers, your doctors, nurse practitioners, PAs, nurses, medical assistants. That puts us in a really wonderful spot in which our ethics are to put the patient first. And we use technology really in an intelligent fashion to make that delivery as convenient, as useful to our patients as possible, rather than making the technology kind of drive the clinical care. And our mission is to make world-class healthcare accessible to everyone. We started out in larger cities. We've now gone to smaller cities where we're creating pop-ups in rural communities. But the idea is to create a network of clinics around the country where we're serving everyone. And part of that is serving our corporate partners, and it's what brings us here together. So Aaron mentioned a bunch of this already, but some of the things that Carbon's working on includes really being at the forefront of the vaccination efforts. We ran the country's largest vaccine program at Dodger Stadium. So you may have seen tweets, Insta pics about people's vaccine experiences, sometimes from celebrities, usually from non-celebrities. And we're incredibly proud of the work of our team in getting vaccines out to as many people as possible. We're also now partnering with local governments to get more of these vaccine efforts into a variety of communities, particularly those that are underserved. Our company was the first to launch something called Health Pass, which is for those who've been vaccinated through Carbon Health. You can show your vaccine status to other organizations, kind of what's commonly called vaccine passports in the media. We're rolling that out in the next few weeks to these the organizations that we're working with, so that people can upload their vaccine cards. Those can be verified and then converted to an actual health pass. And we're just about to hit 2,000 employees who are obviously powering all of these efforts. So we're in 70 clinics across the country. We have virtual care capabilities, so telehealth to over 200 million Americans. And Dr. Weinberg, as humble as he is, he actually started the country's first COVID positive program. So for those COVID long haulers that we all hear about, Aaron's team was the first to have a COVID specific comprehensive care program, which we're incredibly proud of. So with that, I'd love to just kind of jump right into the Q&A. I'm going to stop my screen share and just have a back and forth with some of the questions that have already been shared. So Aaron, thanks again for taking the time to do this with us. I want to just jump right into what's on everyone's mind, which is the vaccines. And perhaps we can start with some of the basic information. Can you tell us what it means to be fully vaccinated and what that means as far as your risk of getting infected or passing on an infection to others? So.
Absolutely. Well, thanks again, Cesar, for having me, and thanks everyone for submitting your questions. I think before I get into answering this question, we've just come so far with this disease with coronavirus, and Cesar, you've probably seen this too. Cesar in the ER sees them being rolled in, and then unfortunately myself in the ICU, I see them, unfortunately a lot of them at their end state when they're passing on from this. And I remember very early on in the pandemic when I was seeing some of these patients, it was almost eerily kind of like the HIV pandemic or epidemic when it started in the US, where we didn't know a lot about the virus. We didn't have a lot to treat the HIV virus. And now we've come so far in that area. And with COVID, we've done the same thing. We didn't know much about this. We didn't know what people were at risk, why people got worse. We didn't have any effective treatments or preventative measures such as vaccines. And it's amazing in such a short period of time, the progress that's been made from a scientific standpoint. I've never seen it in my career. Things move this quickly. And, I'm sure, Cesar, it's probably new to you as well in your career, just seeing the progress that's been made. Before I get into kind of where we're at with vaccines and what it means to be vaccinated, I want to stress that even though we've moved so quickly with vaccines, we didn't skip any of the necessary steps in development. And I think that's been a big concern circulating in the general public, because it moves so quickly, it doesn't almost seem kosher. But I think one of the things that doing research in a pandemic afforded us the opportunity to move quickly. And what I mean by that is many, many resources were devoted to the effort. Financially, companies, everybody got all on board with this. A lot of the technology we used to develop these vaccines were in the works for decades. So it's not like this technology appeared this year and we started to use it. This was something that had been used with other viruses. It had been used in the development of oncology treatments and research. So, I think the backbone was there for quite some time in development, and we were able to expedite the clinical trial process because we were in the middle of a pandemic, which meant that the necessary amount of patients you needed to enroll in a clinical trial was available. We usually aren't afforded that in research. It can take many years to do a clinical trial, but because there were so many circulating cases of COVID, and you need a certain amount of patients to test positive to determine whether something is effective or not. We were able to do that in such a short period of time. So it still went through the normal phase 3 trials where you test safety and then you move on. And once it's safe, then you test the efficacy to see if it's effective. We didn't skip any of those steps. It was still reviewed by third-party review boards, which had no incentives or biases in the development of these vaccines. And they determined that it was highly safe and very effective. So we now have multiple vaccines on the market. We have 3 that have been given emergency use authorization by the FDA in the US. There's Moderna and Pfizer, which fall under one class of vaccinations. They're called the mRNA vaccinations, and we can get into a little bit more detail if people want what that exactly means. Those are the mRNA vaccines, and then we have a viral vector vaccine, which is the J&J vaccine. That technology is similar to a vaccine that has been approved in other parts of the world, in Europe and the UK, which is the AstraZeneca vaccine. So the J&J and AstraZeneca vaccines are similar. And then the mRNA vaccines are your Pfizer and your Moderna vaccines. And all the vaccines have been proved to be highly effective in the prevention of COVID-19. They have been now we also not just have the clinical trial data, but we also have real world data. And that's important because even though something may perform really well in controlled circumstances, such as a clinical trial, we always in medicine want to know how things are doing in the real world when you have real patients with different medical conditions. And we found that not only do these vaccines prevent severe disease, but they also prevent asymptomatic disease. So that gives me a lot of hope, because if you can't get asymptomatic disease, or your chances of it are much lower, I should say, then your chances of also passing it on to others is also lower too. So I think we've shown that it's effective in preventing severe disease from COVID and hospitalizations, as well as asymptomatic disease and probably transmission as well.
And Aaron, kind of on that note, so that we often get questions about, well, which vaccine is better? Is the Johnson & Johnson better than the Moderna Pfizer? I often respond with, well, it depends on if you're looking at the headline numbers or the kind of clinical concerns that doctors have, which is whether patients become severely ill, hospitalized, or die. And it seems like on that metric, the clinical concern, which is, preventing death and severe illness, that all 3 vaccines are equally or fairly equally effective. Is that how you think of it as well?
I think that's absolutely right. I would also caution people, they'll look at absolute numbers. So they'll take the efficacies of these different vaccines and they'll compare them across all the vaccines. One of the first things we learn in research and when analyzing research is you never compare between trials. I think you can't compare the numbers. They were performed under different circumstances. They were performed at different times. So for instance, the J&J vaccine was completed at a later stage than the Pfizer and Moderna. So when the bulk of the J&J vaccine was being conducted, there were many more circulating cases of COVID in the world. It was also done in a wider geographic region. So they were, getting a lot of cases or they were enrolling patients in Brazil, in South Africa. That's where some of the more resistant strains were circulating. So if you did the Moderna and Pfizer trials under those circumstances, you may have seen different efficacies in those trials. We just don't know. But I think the important point is you can't compare those numbers as you would apples to apples. That's not a fair comparison. But I think when you look at each individual trial, you're right, Cesar, they're all very effective, and they're also very effective in preventing severe disease and death, which is ultimately what we would want to accomplish. So I think I feel confident taking any of those vaccines.
Yeah, absolutely. Well, I want to get back to that in a bit, but before I do, I want to get back to something else you said earlier, which is that they're effective in preventing patients from catching the disease, so catching the virus, and then also effective in preventing transmission. Now, in real world, with the real world data, particularly out of Israel and some of the countries that are ahead of us in the vaccine efforts, it seems like even if you're vaccinated, you can still catch the virus and you can still transmit the virus. I've been using the number of somewhere around 75% less. You're less likely to catch it by about 75% and less likely to transmit it by about 75%. Is that roughly what you're seeing as well, or are you using different numbers?
Yeah, I mean, it's those numbers, as you know, Cesar, are pretty hard to kind of estimate and
So,
predict. Certainly you still can catch COVID if you've been vaccinated. It's very rare. You still could technically get severe disease. We even saw that in a couple of the clinical trials, but it's a vast minority of patients that would have that end up happening. I also think that number changes. The more people we can get vaccinated, the more we can get closer to herd immunity, then I think the chances also go down, and that contributes as well to your risk of catching and transmitting. So, I think it's hard to guesstimate the exact number, but I feel very confident based on the real world data I've seen out of Israel, out of the UK, that your risk of both getting severe disease as well as asymptomatic infection is low. And doesn't mean it can't happen, doesn't mean we still shouldn't practice certain, necessary safe practices. But I do feel confident that you are protected if you do get this.
well, earlier you said that you'd be comfortable taking any of the 3 vaccines that are approved under emergency use authorization in the US. And so one of the 3 is Johnson & Johnson's vaccine. The vaccine seems to, the CDC had paused distribution or administration of that vaccine and has now released it again for use. What you didn't mention at the beginning when you introduced yourself is that you're one of the world's experts on clotting disorder. And the reason that the Johnson & Johnson vaccine was paused was because of increased rates of clots. So we're incredibly fortunate to have you on our team and leading our efforts on this. Would you still take the Johnson & Johnson vaccine if you're a male, if you're a young female? How do you kind of connect what the CDC recommended and your research background and you as a clinician? What would you recommend for your patients?
Yeah, no, you're kind, Cesar, for that comment. There are a lot of great experts in this field out there around the world. I have been fortunate to work with some of them in my career. My main area of research focus was venous thromboembolic disease. So that's pulmonary embolisms, which are blood clots in the lungs, and deep vein thromboses, or DVTs, which are blood clots in the legs. Those are, let's break it down for a second. What are these blood clots? Which blood clots are we talking about as they relate to these vaccines? And then we can talk a little bit about comfort level and which populations should be cautious. So in terms of blood clots, and let me start by talking about traditional blood clots, which are DVTs and pulmonary embolism. They're very common. Most people don't realize it. We've done great PR campaigns with strokes and heart attacks in this country, but a lot of people don't realize that pulmonary embolism are significant killers, unfortunately. And it's the 3rd leading cause of cardiovascular death behind heart attacks and strokes. Over 100,000 people die of pulmonary embolism every year. Over 1 million people a year in the US get these kinds of blood clots. So it's a very common condition in the general population. And there's many different risk factors why someone would get those blood clots. Now, when you look at the data from both the clinical trials as well as the real world data, none of these vaccines are increasing your risk of getting those particular blood clots, the traditional blood clots. Okay, so your risk of getting those kinds of blood clots are whatever risk factors you may have in general for getting those blood clots. In other words, vaccines are not increasing your risk of those. What regulators had looked at is a rare type of blood clot. And this is what they describe as this syndrome. And people have thrown around different names for it already, but I think, I've seen different names. One of them is, I'm gonna totally butcher this, but I think it's vaccine-induced thrombotic thrombocytopenia is one of them. I believe there's been different ones that people have suggested, but essentially what this means is there's some people who develop what we think is an autoimmune response to a vaccination. And it's where we've seen this is in the viral vector vaccines, meaning the AstraZeneca vaccine and the J&J vaccine. Now that doesn't mean these mRNA vaccines can't do this also. We just haven't seen the evidence of that to date. But when someone's exposed to either the J&J vaccine or the AstraZeneca vaccine, their own body develops antibodies, which are part of the immune response you normally develop to fight off infections and other things. But in this case, the antibodies not only attack the virus, but they attack yourself. Or part of your clotting cells. They bind to that, and that leads to actually the formation of blood clots in unusual places of the body. So people are getting blood clots in some of the veins of their brain, in some of the veins in the abdominal region, in their belly, in addition to maybe some blood clots in their legs and their lungs as well. They also tend to develop low platelets, which are your clotting cells, because they're being consumed by this clotting process. So it's a rare syndrome. It's in a rare minority of people. Just to give you some numbers on that, with the AstraZeneca vaccine, there's been 34 million people that have been vaccinated with that, probably more now than the last numbers I looked at. But there have been probably about 160 cases or maybe more in under 200 cases in that group. And then with the J&J vaccine, we vaccinated almost 8 million people and there have been 15 cases. So this is a very small percentage of the population of people that get the vaccine that develop this condition. We tend to see it appear within the first 2 weeks of receiving the vaccine. And it interestingly tends to be more likely in younger females. So those under the age of 50 that are female. We don't know why that is exactly. However, other autoimmune diseases sometimes have a gender preference. So that could be part of the reason why it tends to appear in that group. But I don't know, Cesar, what you think about it, but I think it's one of those things, every medication, every therapy on the market, in a very small percentage of people will unfortunately have, adverse events, including death even. And I think we need to keep it in perspective that it is a very small percentage of the population that gets this.
Yeah, and to your point, I think, it's sometimes what captures the imagination is what captures the headlines. So as you well know, and I see in the emergency department as well, that there are common blood pressure medications like lisinopril, and there are probably people on this call who take lisinopril every day. And in certain populations, we see something called angioedema, where the airway, even after years of use, the airway closes up, and we have to emergently intubate patients with that, provide epinephrine. And I've seen, fortunately, haven't had any deaths from that, but I've seen people come close. And so we're used to having every drug have some sort of side effect. I think that, well, with the headlines that are coming out of J&J, it's important that we all take caution, look at the data, look at the numbers, and realize that compared to some of the other medications that we use every day without second thought, that the J&J vaccine is not worse than many of those. But I guess maybe now we can try to get into some practical things. So it sounds like we would be okay with family members taking the J&J vaccine, even if they're young women, maybe even if they're on control pills. Perhaps if we make sure that they don't have some sort of clotting predisposition, maybe a family history, though that's still a gray area. We don't know what factors were involved in the 17 plus cases of these clots forming with J&J. But I'm wondering so now you're 2 weeks after your vaccine, your last vaccine dose, you're considered fully vaccinated. What kind of precautions do you still need to take? How are you advising your patients around? And I'm sure there are family members and everyone but practically speaking, how do people change behavior once they're vaccinated?
Yeah, and maybe before I get into that question, Cesar, maybe I can just make more point on the clotting issue, because I know it's been getting a lot of attention in the media. I mean, I think it's important to put everything in perspective, and sometimes numbers can help with that. So just so everybody on this call realizes, you have a 1 in 100 chance of being hospitalized by COVID-19 infection if you catch the virus, okay? You have a 1 in 5 chance of developing one of those traditional blood clots that I spoke about earlier, PEs and DVTs, if you are hospitalized with COVID-19 infection. So the virus itself is increasing your risk significantly of having blood clots. And when it comes to actually developing this rare syndrome of blood clots from the vaccine, your risk is 0.000088%. Okay, so just putting it in perspective, you have a much higher chance of getting COVID and ending up in the hospital and developing blood clots from COVID infection than you do developing blood clots from this vaccine. So, and we know to date that based on statistical modeling and everything, the amount of the 8 million J&J shots that we've given so far have probably saved close to 120,000 lives. So that isn't to say that the fact that there were 3 deaths due to this rare blood clotting syndrome, that's tragic and unfortunate. We never want to see that at all. However, you got to put it in perspective of the amount of lives that have been saved to date with this vaccine. So
thank you for that. I mean, that just really puts it in perspective, those relative numbers, and compared to not taking the vaccine. Right? Yeah.
So getting back to your question about kind of what you do now that you are vaccinated, and what I think your question was, what do you feel safe to do, or?
So now that you're fully vaccinated, what kind of activities, how can you conduct your life differently than if you weren't vaccinated?
Yeah, and I think what we all want is a return to normalcy and freedoms and stuff. I'm still personally recommending to my friends, family members, still being cautious. I think we're still in this phase where we're seeing we know the vaccines are effective, but we still are collecting real world data. We still need to see how long one's immunity lasts. So just because you've been vaccinated, we don't know how long the immunity will last. We have some studies. There was a Moderna study which showed that people do have significant immunity up to 6 months after receiving the vaccine, which is reassuring, but we don't have any long-term data on that. So we have to, kind of still realize how long the immunity lasts. 2, there's still circulating strains of resistant strains. So we need to continue to monitor that and see whether people who have been vaccinated are developing infection down the road. So there's still some unknowns out there. But with that said, I think the data look good enough that we can start opening up a bit, which means that if you're getting together with people who have already been vaccinated, it's safe to probably, share a meal with them, take off the mask, do things like that. I would say if you're still in a group of crowded people, like at a concert or a sporting event, it probably makes sense to still wear a mask. And the CDC released some new guidelines this past week on that. So I think it's just about kind of still taking necessary precautions, but slowly opening things up, slowly relaxing what we do, and then always monitoring the situation and collecting more data.
Yeah, and
how do you feel, Cesar? What's your perspective on this right now?
Well, yeah, thanks for asking. I think, there are some variables that are coming to the forefront compared to a year ago. So if you remember, and I know you do because we talked about it, but a year ago we were worried about surfaces. We were worried about ventilation in office buildings. And so you saw companies instituting these cleaning efforts every hour, every couple of hours throughout the offices. It seems like now with more data, we're able to kind of wade our way through, again, some of the hype compared to some of the factors that are more real. So it turns out, again, CDC also highlighted this recently, but I think we were aware of this months ago and we're making recommendations around it. But the idea that outdoor activities are safer than indoor activities. There's some additional data around time spent indoor as an important factor rather than just, are you within 15 minutes of someone who might be infected? Masking is clearly an important component. So just as you nicely highlighted. And then the other variable that we can throw in there now is vaccinated or unvaccinated. And so there seems to be two sets of ways of interacting. One is with adults who are vaccinated, and one is in a mixed setting. And so in a mixed setting, for the protection of those who are unvaccinated, I think maintaining all the precautions is important. You don't want those people to get infected, even if you're less likely to infect them because you're fully vaccinated, you can still infect them and be a carrier. In the setting of a fully vaccinated population where, where those people are also interacting with low risk groups. So perhaps it's a group of parents who are all vaccinated and they go home to young kids. In those settings, you may want to relax those precautions. So take off your masks, share a meal even, kind of more back to normal pre-pandemic response. But that's, again, if the groups are only interacting with vaccinated folks and or low risk individuals, which I characterize as 24 years old and under, again, based on the death rates of COVID. So yeah, that's kind of how I've been thinking about it, and it seems like it's supported by the data as well.
Yeah, and I think that's a great point you raised, Cesar, about the at-risk population. So if you have at-risk individuals in your circle, maybe you live with them, maybe you see them on a regular basis. Some of them, obviously children are not being vaccinated right now. So they're, and even though they may get less severe disease, there have been cases of severe COVID and even deaths in children, and weird kind of vasculitic, which is kind of inflammatory processes of the vessels that we've seen in children. So, until we have vaccines for them, and there are ongoing trials, being cautious around your children. Also, at-risk groups could be those that are immunocompromised, maybe because they're on certain medications that lower their immune system, or maybe they have active cancer, let's say. or maybe someone's pregnant. We know that pregnant patients are more susceptible to catching COVID and also having more severe outcomes from COVID. So, I think it's always good to keep your inner circle in mind when you're making these decisions.
Yeah, absolutely. And it seems like again, if we go back to the numbers, and you mentioned the vasculitic process in kids, as one of my kids just ran by, it seems like the numbers are incredibly low for that as well. So again, if we're so important to be aware of, but maybe not a large enough percentage of people affected that that we would completely maintain the same cautions that we're doing. I'm curious. So based on what you're saying about the Moderna studies showing that there's antibody response 6 months post-vaccination, is your sense that we're going to need to get booster shots every certain period of time?
Yeah, we don't know that yet. I know these companies are definitely developing them and testing them should we need them. However, we don't have the data yet to know whether they are going to be needed. And I think it'll come down to a couple things. One, how long one's immunity lasts. So if you get good immune responses for a long period of time, we do have vaccines where you don't need to keep giving boosters. And then you do have vaccines where you do, like the flu shot. And part of that has to do with how well your immunity lasts. It also has to do whether there are resistant strains that emerge. So if we start seeing a trend where those who are vaccinated start developing COVID at a higher rate, then that may be an indication that the vaccine is less effective against a particular strain. And in that case, we may recommend a booster. But even though they're in development right now, it's certainly not a foregone conclusion that we're definitely going to need them or recommend them. It's kind of a wait and see sort of situation.
That totally makes sense. Yeah, seems like we're all hopeful that hopefully the one vaccine series will be enough. But to your point, there's still so much more that we need to wait on. So let's see. Want to maybe go through some of the Q&A.
And I think also, Cesar, one other thing I've been thinking a lot about too is we need to get to that herd immunity point. I think it's really important because not only can we cut down the spread within the US, but we can also cut down the chances of a really resistant or more deadly strain occurring. The more we can get closer to that herd immunity point. And we know the efficacies of these vaccines are all good enough to get us to that point. The other factor is, can we vaccinate enough people? So you need a vaccine that's effective enough, and then you need to vaccinate enough people to get to that herd immunity. And estimates are that we need to vaccinate anywhere from 70 to 80% of our population to really achieve herd immunity and cut down the spread of this disease. And then we got to vaccinate the rest of the world too. I think sometimes it's easy and it's human nature to focus on your own country and your own population. But remember the tragedies that are going on in India and other parts of this world, Brazil and other parts. The more that virus replicates, the more it's transmitted, the more it copies its own genetic material as it spreads, the more chances of mutations occurring. And those mutations can then lead to more deadly and more infectious strains. And given how interconnected our world is, it'll come back to America as well. So I think we need to have a broad enough vision that we also care about vaccinating the rest of the world in addition to our own population.
Yeah, so kind of a plug for for how interconnected we are, as well as potentially that the virus will mutate to the point, given how many people in the world are infected by it, with it, will mutate to the point where we may need additional booster shots aimed at a slightly different version of this virus and in the coming years. Along those lines, I know you've been spending a ton of time on kind of vaccine data. what are you hearing about children and availability of vaccines for those under the age of 16? Do you think
Yeah,
that will happen this year?
I think, I've seen estimates anywhere from the end of 2021 to the beginning of maybe 2022 fall. It's hard to say. It just depends on, their enrollment and their, whether they get enough patients and whether they can do it quickly. So it's a little bit of a moving target, but I hope by the end of the year or beginning of 2022 we'll have more vaccines accessible to children.
Yeah, and I had heard, and I'm not sure how legitimate this is, but I heard that potentially for 12 to 16-year-olds, we might get approval, by late summer, early fall. But honestly, I haven't seen anything official. It's just like through some of the vaccine scientists that
They
I,
could liberalize certain segments of the
yeah,
population before others, so that's possible that they may drop the age. I think just to remind our audience participants here, the Pfizer vaccine is approved for those 16 and older. Moderna is for 18 and older. Chances are Moderna could also be approved for 16 and older or younger even. The reason they determine those cutoffs is because that's just how the studies were done. So, you can only approve what has been studied. So Pfizer in their clinical trial decided to make the cutoff 16, which is why they got that EUA authorization.
nice. So, so some of the other questions on people's minds is, now I'm vaccinated, as more and more Americans are vaccinated. Can I go to Canada, Mexico? Can I travel internationally? Can I travel domestically? How do you answer that one?
Yeah, well, the latest, CDC recommendations is that if you have been vaccinated, you can safely travel in the US, and you can even travel abroad. Obviously, I would recommend wearing a mask when you do that. Unfortunately, there's still a lot of restrictions when you do go abroad right now. A number of countries won't let you in unless you have certain business or family there. A number of them are still recommending, 10 to 14-day quarantines in a hotel. So that may not be the most fun vacation in the world. But I think from a safety standpoint, recommendations are that you can travel. Obviously, going to certain countries do increase your risk that you may encounter one of the more resistant strains. So that's always a concern to yourself, as well as what you bring home back to the US. But I think if travel can slowly be done in a safe fashion now that more people are being vaccinated.
Another common question that we're getting is, I'm pregnant or I'm trying to get pregnant. Can I get vaccinated?
Yeah. So like I mentioned earlier, your risk of both catching COVID-19 as well as having more severe disease is higher if you are pregnant, and therefore patients who are pregnant could have worse outcomes, including death, and it could also be detrimental to the baby. Now, with that said, we don't have robust data. None of the clinical trials had very large data on the safety and efficacy in those that are pregnant. There are registries, and we are collecting more and more data. There have been some recent real world data that's come out that believes it is safe and efficacious. In addition to all the basic science research that was done, there doesn't believe that any of these vaccine technologies pose a threat to the mom or to the baby. Now, countries have taken different approaches. There are countries in Europe who have said, you know what, we don't recommend vaccinating moms, because we just don't have data on it. And that's kind of an approach that some of the European countries take. They want to see large amounts of data before they approve something. In the US, we took a slightly different approach in the American College of Obstetrics and Gynecology recommended that pregnant patients get vaccinated because based on the data that we had and all the studies that have been done, they believe that it would be safe and effective for pregnant patients. So I think most providers in the US would recommend that pregnant patients, do get vaccinated. But it's always worth a discussion of the risks and benefits with your own provider to see if it makes sense for you. But, just anecdotally, I can speak, my wife was breastfeeding, and we made the decision for her to get vaccinated. And so far our baby's doing great. So.
Love that. Yeah, I know. And it wasn't easy. I mean, just thinking about all the people out there, your wife's a surgeon, your pulmonary critical care, and it was still a tough decision, right? In the face of limited information. So just to kind of point out how hard it is for those out there who are trying to digest their own information, maybe even without a medical background.
Yeah.
Along those lines, there's also a concern still, will these vaccines have long-term side effects that we're not even on our radar today, but perhaps in 5 years, 10 years, we find out that the vaccine causes fill in the blank. I can't even imagine based on the science, but how are you responding to patients who ask that question?
Yeah, we don't believe so. Based on years and decades of research in these areas and with vaccines in general, we don't believe that there's any mechanism here that will lead to significant long-term adverse results. When both of these vaccines work similarly, and I think it's not to bore everybody on this call, I'll try to not talk too long about this, but I think it's important to understand the mechanism of how these vaccines work in order to understand the safety. So whether you're talking about the viral vector vaccine or the mRNA vaccines, the goal of the vaccine and the vehicle is to get it into the cells. So to get a code into the cells. And that code codes for the spike protein, which is this protein that sits on the outer part of the COVID virus. And you may have seen pictures of it. It's like these little spikes that go out from the COVID virus. So the code that is delivered into your cells, and in the mRNA vaccines, it's kind of this fatty lipid vehicle that takes it in there. In the viral vector vaccine, it's this inactive virus, so it can't cause infection, but it helps the code get into the cells. It codes for that spike protein. Your body produces the spike protein and then recognizes that it's foreign and develops an immune response against it to help fight any future infection that you may encounter. That code never gets incorporated into your own DNA. It gets degraded or destroyed, purged, goes into the, in the computer analogy, goes into your trash bin and destroyed very quickly. So it doesn't get incorporated into your DNA. And we really worry about, if we are going to worry about long-term complications, it would be genetic material kind of messing with our DNA and causing mutations. And that just doesn't occur with this technology. So the code's destroyed. We know that it's safe to train your immune system the way that these vaccines do. We've had many decades of experience with that, with other vaccines. So, I really don't see this as being a long-term problem. I think we know enough about the mechanism to be reassured by that. Obviously, we'll need to collect data in the future, but I feel pretty safe about it. What do you think, Cesar?
Yeah, well, before these vaccines came to market, I was fairly skeptical about the safety profile. Similar to what we heard in popular media as well, which was like, how can we so quickly get a group of vaccines to market so fast? And what are the longer term side effects of such a vaccine? When the data were finally released and shared by the manufacturers, by the CDC, et cetera, I became a total convert, which was, wow, this is the most studied group of vaccines that we've ever had. And when you looked at the side effect profile, it wasn't even a soft call. It wasn't like, yeah, X number of people are coming down with, these weird things and others are not. The blood clotting side effect with AstraZeneca and Johnson & Johnson, again, were somewhat expected because that was the adenovirus vector. And that was consistent across all the studies. With the Moderna and Pfizer, which was a brand new type of technology that we're incorporating, that's where my hesitancy came from, is how is this new technology going to affect us? But when you looked at the numbers, the sheer number of people who were vaccinated, and then looked at the science behind how this vaccine works, it became kind of a no-brainer to recommend it to my patients and to my family members and myself, because it was incredibly reassuring to see the vast numbers. And now that it's been in the market since December, and countries like Israel have vaccinated such a large percentage of their populations really without any significant side effects. Again, going back to that point about blood pressure medications, which, this isn't to say stop taking your blood pressure medication. Of course, you should continue those medicines that are helpful to you. But if we had distributed the same number of fill in the blank medication, the point is that we would see worse side effects, a greater percentage of people who are impacted than we have with these viruses. And I think that that's something that we should, as the medical community, communicate to all of our patients, all of our colleagues, to make sure that the public understands just how safe this is. To the point that we've all taken it. I mean, I know you took it. I took the vaccine. Our spouses who are both physicians are vaccinated. We had no hesitation for family members in recommending it. So
yeah, I think you're right. I mean, each trial had over 30,000 people enrolled in it, and now we've had millions and millions of people around the world receive these vaccines, and very, very few adverse events.
And all at different stages of their lives. So from 16-year-olds to 99-year-olds.
Yeah, my 102-year-old grandfather got it too. So he did well.
Oh my God, that's so cute. Okay, well, so just going back to the office environment for these vaccines, more and more offices are opening up, and there are large companies and small companies that are inviting their employees back into the office. Is returning to the office safe to do? And if so, what are the precautions that we should still maintain?
Yeah, obviously everybody's set of circumstances is different. We've already talked about what it means if everybody's vaccinated. So that plays a role. We've already talked about if you live with someone who is at increased risk, maybe you have to be a little bit more cautious with things. So, it's kind of hard to create a blanket statement or recommendation across the board in this area. However, I think it is, if you are vaccinated and your risk profile's, fairly low, then I think it is safe to go into an office. Obviously, if you were going to use CDC guidelines and extrapolate from that, if you are indoors, it probably makes sense, even if you are vaccinated, to still wear a mask. If you're in an indoor setting around other people. I think we can slowly start doing that, and obviously wash hands and do the necessary things that we've been doing all along. But I think if you take those precautions, it's probably fairly safe to do something like that. I don't know, Cesar, what your opinion is on that.
Yeah, well, so I completely agree with your with your stance, which is that it's hard to make a blanket recommendation to all, every employee across all companies, because different companies are taking different precautions. I think the companies that we're working with through the COVID Ready program have really done a phenomenal job in preventing workplace transmission. And along those lines, many of them are maintaining additional precautions. So doing surveillance testing, even in the asymptomatic population. So people who don't have symptoms are still getting tested, maybe not weekly like we were doing before, maybe slightly less frequently, somewhere between 2 and 4 weeks, depending on, again, as you mentioned, the risk tolerance of the company. I do think that, with fully vaccinated individuals, even indoor, and I know nearly all the companies that all the companies that I'm aware of have great ventilation systems in place, are maintaining surveillance testing, but and are doing the daily symptom tracker. So if people are symptomatic, they're not really coming to work. So with those additional precautions in place, when they're indoor and they're in a fully vaccinated setting, so perhaps in a conference room where everyone's vaccinated, and we know that none of them have symptoms, and we know that they're getting regular surveillance testing as well, that perhaps in that scenario they can take off their masks, understanding that the transmission between, even if one of them fell through all the cracks and was infected and asymptomatic, transmission between that individual and their colleagues is much less efficient. So it's, I've seen the range from 50 to 75% less efficient. I've actually seen higher numbers, but the data were a little bit more questionable. And to your point earlier, it's hard to know exactly what that efficiency is. But knowing that the transmission rates are less, and the transmission from, again, so now you've got a vaccinated individual who's infected, this low probability process of infecting a colleague. That colleague's also vaccinated, so it's a low probability for them to catch it. But let's say it happens, and then they go home and they potentially pass it along to a family member. If the family is composed of low risk individuals, then perhaps people are tolerant of all the risks there to, again, take off their masks in the conference room, show their health pass to say, hey, we're all vaccinated. Are we all okay with removing some of the precautions and feeling like we're going back to normal? Of course, it's case by case. Individuals will need to feel comfortable in saying, I know we're all vaccinated, but I don't really feel comfortable myself in having my colleagues with their masks off. And we need to find mechanisms where we respect their individual choices and healthcare decisions, and respect all their colleagues' decisions and desires to kind of go back to normal. So it is complicated, but I think Carbon's role is to create some guardrails and say, the science doesn't support you taking off your masks when you're in a mixed population, because you can really infect those unvaccinated higher risk individuals. But again, with everyone understanding what the risks are, perhaps in a low risk population, it's okay to rely on some of our.
Yeah, I think you raise a good point. I think my initial comment had more to do with if you're not controlling for all those factors, but you're right. I mean, if everybody's vaccinated and everybody feels like they are low risk and around low risk people, and then I think you're right. And you are monitoring certain things within an office setting, then I think you're right. It is pretty safe to take off your mask. I'm thinking about those situations where maybe you have a business where you don't have all those.
Right.
You can't control for all those things. You don't know all the vaccination statuses, or maybe people aren't vaccinated within the group. Maybe you aren't monitoring things as closely. According to the latest CDC mask guidelines, you would want to still wear a mask in that kind of setting. And, for the most part, if you're in public in an indoor setting, whether you're going to a hair salon or a place of worship or a restaurant or whatever it may be, even if you are vaccinated, the recommendation is still to wear a mask in those sorts of settings. So just wanted to clarify that point.
Oh, that's perfect. Well, thank you for that. And I just realized that we're over time, so we could probably go on talking another hour about this. But want to thank everyone for joining. This webinar is available for distribution. It was recorded. If you have additional questions, please reach out to your contact at Carbon. We'd be more than happy to weigh in on any outstanding questions. And then also, if you have, as Dr. Weinberg was saying, if you have an individual circumstance that you'd like our input on, we'd be happy to weigh in on that as well. So Aaron, thank you so much.
Well, thank you, Cesar. It was really enjoyable having a conversation with you. And thank you everyone for all your great questions.
Yep. Have a great rest of your day. Okay. Bye.